So, one of the things that can come up for some kids with autism is challenges with dental hygiene.
My name is Nancy Marchese. I'm a board certified doctoral level behavior analyst and a clinical psychologist. My goal is to help 2 million children with autism and their families by transforming their lives, and I can't wait to help you too.
And this is not just about, not brushing their teeth at night and, okay, oh well, tomorrow we'll deal with it. This can lead to serious chronic issues, such that for some kids, they may even have to be hospitalized in order to adequately deal with their teeth care. Behavior analysts can help with this. We can help break down the key steps when it comes to dental hygiene, and not only that, but also dental visits, such that your child doesn't have to end up in unfortunate situations that require intensive medical care. The key here is to tackle this head on and systematically. Don't wait. If your child has trouble brushing their teeth, if your child has trouble going to the dentist, which by the way, many of us do, it's not always the easiest thing to deal with. What we want to do is allow for multiple practice opportunity with smaller steps such that your child is successful, so that we can build on those practice opportunities, so that ultimately they're going to the dentist without any challenges. They're brushing their teeth, they're flossing their teeth without any challenges. How do we do that? It's through something called exposure and reinforcement. So instead of waiting until the moment every 6 months or every 4 months of having to go to the dentist, or waiting till the teeth get so bad that we have to get in there and really brush super, super good, we want to have lots of exposure opportunities, as many as possible, leading up to that dentist visit, leading up to a child being able to brush their teeth in its entirety. So, how do we do that? Just like we do everything else in behavior analysis, we want to break it down into super small steps. We want to figure out where the bar is. So, for example, if your child's bar is that they will only tolerate the sight of the toothbrush before challenges occur, okay, that's where the bar is set. We're going to slightly up the bar, ever so slightly, where in which it might be, for example, bringing the toothbrush a little closer to their mouth. And then what do? We have the party, the reinforcement. As they progressively are able to tolerate that, then we want to up the bar again. It might be touch the toothbrush with the lips, for example. We also want to think about when we're going to introduce the toothpaste. It might be super diluted toothpaste at first, and then we slowly, progressively increase it from there. Same thing goes for those dentist visits. Find a dentist that'll work with you. Find an office that would be open to perhaps some preliminary visits to the office, even if it's just in the waiting room to start with, such that your child can associate those visits with good things. You set the bar. The bar might be we're just going to go into the waiting room, and then we have the party, the reinforcement. We have multiple practice opportunities by which we've just raised the bar slightly. Your child will succeed when that happens, especially when you deliver the party. And then what do? We up the bar again. So, if you take this notion of exposure and reinforcement and gradually expose your child to successive steps along the way by which they are successful and they get that party, I can guarantee you that they can be well underway to helping to support good dental hygiene and good overall health.
There's only so much we could cover in the short amount of time we had today. If you found value in what we talked about, go to breakthroughautism.ca, join our newsletter, and also follow me on my socials.